Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. If you have your book, I invite you to turn to page 93, where we will continue with basic questions and commands. If you don't have a book, let me encourage you at this time to obtain a copy. It will make it much easier to follow along with these series of videos. You can see what I'm saying and see what I'm referencing as well as hearing. But you are welcome to follow along even if you don't have the book. That's fine. So, vamos a empezar. On page 90, actually, let's go back to page 92. On page 92 in the book, on the last video, you will notice that I did not complete the last question on that page because the translation was on the next page. So we'll start there. This one is for our speech therapist. Our speech pathologist, generally, when they're doing an eval for the patient, one of the questions that they're going to ask is, has the patient had any problems with swallowing prior to coming to the hospital? So that's important to know. So the question in English here is, have you ever had difficulty swallowing prior to coming to the hospital? Now, in the book, I'll read what I wrote. ¿Alguna vez ha tenido dificultad para tragar antes de venir al hospital? ¿Alguna vez ha tenido dificultad para tragar antes de venir al hospital? And one more time. ¿Alguna vez ha tenido dificultad para tragar antes de venir al hospital? So that's very wordy. So I wanted you to hear that, but I'm going to give another translation. So, antes de venir al hospital, tenía problemas para tragar. Antes de venir al hospital, tenía problemas para tragar. One more time. Antes de venir al hospital, tenía problemas para tragar. So both of those are asking the same question. And remember, I said in the previous videos, what's in the book is not the only way to say it. It's basic and it's a way to communicate what your thought is. So the thought I wrote in English and then how to communicate that. But you may ask someone else and they say, well, I wouldn't say it that way. I would say it different. And that's okay because there's more than one way to say it. So that's important for you to know. The next one, have you lost weight recently without trying? So if you're asking a patient to see, especially with, it could be, I think it probably would be either the occupational therapy clinicians or speech language pathologists would ask that question because that may have something to do with their endocrine system, with their sugar levels, if you're losing weight and you're not even trying. But I'm not trying to give any kind of diagnosis here. This is just for purposes of asking a question. So, ha perdido peso. I put a word in here, recientemente, which may be a little bit hard for people to pronounce. A lot of syllables. So let's take out that word for purposes of the video, and then we could stick it on the end. So listen. ¿Ha perdido peso sin intentar? ¿Ha perdido peso sin intentar? ¿Ha perdido peso sin intentar? So, have you lost weight without trying? If you're able to, let's practice that word that's in the middle. Recientemente. 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 So if you put it all together, ha perdido peso recientemente sin intentar. Ha perdido peso recientemente sin intentar. And one more time, I'll do it a little bit more slow. Ha perdido peso recientemente sin intentar. Okay. The next one is if you want someone to hold their breath, hold the breath. Usually we're telling people to breathe, but there are occasions when you're saying, hold your breath. Okay. So, contenga la respiración. I'll do that slower. Contenga la respiración. Again. Contenga la respiración. Okay. The next one, hold the rail as you go downstairs. Now remember in the previous videos, I've always said it's very helpful, almost important, really, really important for you to use visual cues. So generally, if I was doing this one, I would actually go down the stairs, meaning someone's guarding your patient. I would go down the stairs and show them, talk to them as I'm going down, holding the rail, make emphasis to that. So I'm going to introduce a word, barandilla. La barandilla, which is the rail, okay? So, sostenga la barandilla mientras va abajo. Let's do that slow. Sostenga la barandilla mientras va abajo. Let's do it one more time. Sostenga la barandilla mientras va abajo. And that is one of the things that people will be able to understand when they have a visual and they have the auditory. It makes it much, much easier to understand. Okay. The next one is a question. How are you feeling today? Whatever area of therapy, whether you're in therapy or not, that's a question that we ask our patients almost every single time. Sometimes just out of kindness. We even ask this to each other. ¿Cómo te sientes? And if you want to say today, it's hoy. ¿Cómo te sientes hoy? ¿Cómo te sientes hoy? ¿Cómo te sientes hoy? So many people know a little bit of Spanish, and that says that's not what I remember. If you go down to the next one, how are you? ¿Cómo estás? ¿Cómo estás? ¿Cómo estás? So that's another way of saying it. One, the first one, ¿Cómo te sientes hoy? Is asking, how are you feeling today? Which is a question that healthcare practitioners are always asking our patients. But how are you is generally, how are you? ¿Cómo estás? Okay. And the last one, again, I'm going to introduce some words first and then we'll do the sentence. It's medicamentos. That's medicines, okay? And then puree, which is like a puree, okay? And this is a question that many speech language pathologists are asking their patients for swallowing purposes, okay? So, ¿cómo toma sus medicamentos en casa? ¿Con el agua o puree? So you're asking the patient, how do you take your medication at home? With water or in a puree, like a sauce, like applesauce or something like that, okay? So, ¿cómo toma sus medicamentos en casa, con el agua o puré. Let's do that one more time. ¿Cómo toma sus medicamentos en casa, con el agua o puré? So you're asking that to the question to the patient because you're wanting to find out, can they just drink it with water? Were they having problems prior to this? And many of these questions were developed with the help of some of the speech language pathology clinicians that I work with at my company at the hospital. And I asked them, I did a survey with them, what kinds of questions do you ask patients on a daily treatment session or during an assessment? So that's where these questions are coming from. I surveyed some OTs as well as working in OT. I surveyed the physical therapist, and these were the questions. These were the words that they said, hey, this would be helpful if we knew. So there are over 500 words and phrases and questions in the book. It's a little book, but it has a lot in it. So with that being said, gracias por venir, and I will see you in the next video. Adios.